So I want to welcome you all. I'm letting people in here real quick. Thank you for joining us at Virtual Dementia. Today, our topic is all about music therapy. My name is Sarah Hatch, and I'm one of the social workers here at Sanders Brown Center on Aging. And we're glad that you're here to be a part of this programming. As a reminder, we do record these presentations, and then we do post them online to make them easily accessible. I will put the link in our chat so that you can find all of our past virtual dementia talks as well. We'll be monitoring the chat, so if you have questions, put them in chat, and at the end, we will have time for questions. I'm excited to introduce our guests today, Maggie Shepman-Sunshine and Maren McGimsey. Maggie is a music therapist, and Maren is a social worker who is working with music therapists as part of research study here at the University of Kentucky, and they'll share a little bit about that project as well. So let's please welcome our guest.
I am kind of starting this out. I am a music therapist, as Sarah said, and I have been working as a music therapist for about 10 years now. So just a bit about my background really quick. I currently work in private practice and work with adults with intellectual disabilities and kiddos on the autism spectrum and some other things, but I have worked in the past for a number of years in a hospice setting and memory care setting. So I am very familiar working with adults who have dementia and providing music therapy for them. I am originally from Iowa, so some of my stories, you might hear some of that back in Iowa. I started out there and then moved to UK for my master's, and that's how I ended up here and working in Lexington. But I do not have a presentation, a PowerPoint put together. I have a presentation for us all, but I figured I'd just talk, and I would love to hear everybody's questions and experiences with music therapy and answer as much as I can, because I know that some people have heard of music therapy, they're really interested. Some people may not have heard of music therapy at all. It's very common not to know much. So, just a really quick overview of what music therapy is. Music therapy is the use of music and the therapeutic relationship to address goals of a client or a patient to improve their lives. So overall, we're always looking to improve somebody's quality of life and to help them achieve the goals that they want to achieve. So it is a very tailored approach to care, very holistic, and we work with our clients or their caregivers to promote these improvements in quality of life. So that might be something as far as communication goes and increasing some of those opportunities for communication. It might be, increasing those opportunities for socialization with others and maintaining some of the cognitive skills that somebody has. And this would be at the beginning of the dementia diagnosis. So maintaining some of those. And as the process unfolds with dementia and an individual goes through that experience, we might focus more, once the dementia is more advanced, we might focus a bit more on relaxation and stress reduction for a patient or a client. And we might focus on, caregiver support as well. So it really depends where a person is on that spectrum of that diagnosis and what is important to them, as well as the music that's important to them. So we really try to use music that is preferred by a client or patient and enjoyed by them, rather than having pre-selected music that maybe isn't just as interesting to somebody. So we really do work towards finding that music that's going to work best for a person. So my job as a music therapist starts by getting to know the patient or the client, determining what they deem important what goals they want to set for themselves or what goals the caregiver wants to set for somebody, and determining how we're going to do that with music. So we might decide that this individual, this person that I'm working with, has always been somebody who's interested in puzzles and keeping their brain sharp and wants to continue to do that even as they're experiencing some decline. So my job then becomes, how do I make music accessible to them so that we can still use those cognitive skills that are there and maintain them? Maybe somebody plays an instrument, and so we might play together, and I might provide some of that musical support so that they can continue to play in, even though they might not be able to go somewhere and play in a more formal setting, but they still get that opportunity to challenge themselves to read the music, to play the instrument, and play along with somebody. For a social opportunity, we might set up a group in a memory care unit, as far as providing that opportunity for individuals to make music together and to interact together and not have to have a discussion to interact. It's another opportunity for us to interact with each other, but it doesn't require verbal participation necessarily. And we might, look at mood and emotional well-being. So we might decide to play a drum that represents how we're feeling that day. And find those strategies that works for somebody to really engage with life to the best of their abilities as a music therapist. So a lot of times people ask me, well, what do you do then? What do you do during a session? And I can kind of give you an overview of, what a session looks like and where things might be adapted. So a lot of the times I like to keep my beginning and my ending songs. I don't always sing hello. Usually in a group, I do. So keeping those beginnings and ends pretty much the same each time, so that we know that we're starting music and we know that we're ending music. So a lot of times I like to use the song, Hey Good Looking. I am sure everybody knows that, but hey good looking, what you got cooking? How's about cooking something up with me? And we might just repeat that. If that is what is familiar to somebody and that is what will get them to sing along with me, we might just sing that a couple of times. Um, so I usually start with that and just kind of gauge where everybody's at. I often like to then move into singing You Are My Sunshine. It's a very well-known song, and I again find that people will sing that with me pretty easily. And so we start there, and that gives me the opportunity to assess where everybody's at that day, see who's singing along, who's making eye contact with me, who's still a little bit sleepy, maybe somebody's a little bit grumpy. So I take that time to really get to know clients and group members or individual clients and see how they're doing that day. So that's usually the start. And then we might um, introduce some instruments. So I might start playing a different instrument. Usually I start with guitar, and then I might start playing a drum to really focus on the rhythmic aspect of music. So starting that really steady beat, encouraging people to find that themselves. So maybe they're just going to tap their leg or clap along if they'd like to, and introduce some sort of theme. One of the things that we can do with music very well is reality orientation. So right now it's fall. We might introduce a fall theme, and all of those songs are gonna revolve around the time of year, so that if we happen to have a conversation of, falling leaves, the song Falling Leaves, and oh yeah, I've seen these leaves falling. Um, different colors of the leaves and all that sort of stuff. And so it really helps to keep us grounded in what's going on in the here and now. And if somebody's not there and we need to adjust, we adjust. But providing that support and structure, and then building the session as we go, and building the engagement and the stimulation. We don't want to provide a lot of stimulation all at once if somebody's not ready for that. They might be ready for that, but we want to make sure that we're building it so that everybody has the best possible outcome that they can. So I might start with an instrument, and then I might hand out some instruments so that we can all play together. And as we go, playing and layering in some of these aspects of music to become more complex and to engage people more. Usually after we've kind of like really gotten into the groove and I've gotten people playing music with me and all of that, we slowly start to wind down. So we might pick some slower songs to play along with. Maybe I'll collect the instruments and then we'll sing it together again, sing a few songs, and then close with the same song that we use continuously. So for me, a lot of the times that is Happy Trails. I find a lot of people know it, and it's just a fun song to sing. But especially when I'm working with people with dementia, I find that Happy Trails, Hey Good Looking, those are always some good ones. You might be wondering what other songs usually seem to go well. I've had a lot of success over time with Home on the Range. And as I said, You Are My Sunshine, Bicycle Built for Two. So these songs that are older, and traditionally in the research, we prefer our music from our young adulthood. So that's usually the music that as we go throughout our lives, that's really like our main preference. Doesn't mean that it's our only preference, but that tends to be a strong musical connection for us. Sometimes when we have dementia and we're working with people with dementia, we need to go back a little bit further. So we need to think about what was the music that they were listening to when they were a child. What was the music that they were listening to or making when they were interacting with their parents? And so some of these songs that seem a bit older might be those songs that were used to interact with their parent, with their peers. They might be learning that in school. They might be singing Christmas songs. Frequently, Christmas songs are pretty well known because they stay fairly the same throughout our lives. There are new songs that come out, but there are those old standards. They're popular. Plenty of people sing them and know them. And so they are really ingrained in our brain and are familiar enough for people to sing along with. But that familiarity is key, and that predictability is key when it comes to music. That is what provides comfort for us. Our brains love to know what's going to happen next. They love to know that they can predict what is going to happen next. And in music, we often can. Even if we don't realize that our brains are predicting what's coming next, they are. And when we use familiar music, it just reinforces that predictability of knowing in this 2-minute song, I know what's going to happen because I know the words and I know the chords. And even if I couldn't tell you, on paper that this is coming next, if I never even learned how to read music, any of that, our brains know what's going to happen next in that song. And so it provides a lot of comfort for people, and not just people with dementia, everybody. I was just on a flight yesterday and I don't like flying at all. It is not a fun experience for me. And one of my big coping mechanisms when I'm flying is to play music that I know, that I like, that is predictable for me. And so I'll listen to just one album over and over because I know what's coming next each time. And it's comforting to know what's coming next. And so that's one of the really great things about music is that we can use that for relaxation, for stress reduction, even if it's a fast song, even if it's a really like upbeat song, if it's a familiar and preferred song, it's still providing that comfort for us. And so it's always so exciting to figure out what those songs are for everybody because they're different. We all have different experiences and connections to music. We can listen to the same song and have a completely different outlook on it. We could, connect to it in a completely different way, have a different memory associated with that song. And so, even though we all have our own individual experience with a particular song, we still can get the same outcome from one person to another, even though we have those different connections. So we might still be happy and relaxed after singing Bicycle Built for Two, even though for someone it reminds them of riding their bikes in the summer and going out. And another person, it might remind them of a familiar caregiver who would always sing that song with them. Either way, those connections are positive connections and bring back those positive memories. So it's kind of universal in that way. But that does bring up the case then that it is important to be aware of the music that you are playing and that you are using with each individual person because even though I might have a really positive connection to a song and really love it, for another person, they may not. It might be tied to an anxious or an unwanted memory for that moment in time. And so we need to be aware of somebody's preferences and history and experiences with music to know that we are using the right music for that person. If not, it can lead to agitation or, it can lead to decreased social interaction. Somebody might withdraw and leave the group because they don't like the music or it brings up a feeling that is not pleasant for them. Um, so being mindful of that, and that again is where it's my job to make sure that I'm monitoring what's going on when I'm working with somebody and choosing music that is going to promote the outcomes that I want to see, that I hope to see. Um, so it's something to be mindful of 90% of the time, 95% of the time. When you put on music, somebody's going to enjoy it. But there are going to be those times where we just need to be mindful of, oh, are they starting to close their eyes? Are they closing their eyes because they're relaxed and they're enjoying the music? Or are they closing their eyes because they want to withdraw? Are they trying to leave the room? Were they content when we started? And once they heard a certain song, they said, oh, I have to go, I have to go. So being mindful of a person's response to music, but it can be very, very helpful and powerful in everyday life when we're working with people with dementia. And, you know, I'm a music therapist. I might see people once a month or once a week. As a caregiver, you know your loved one that much better. You are with them so much more often. And so you know their preferences and you know their responses to determine if they're having a positive or negative response to the music. So you might just, if you don't know exactly what music somebody likes, you can start by playing some, really popular music and just see how they respond to it and how does that change their demeanor. Um, and so once you've determined those, put together a playlist and use your Spotify or your Apple Music or something and have that playlist ready to go so that all you have to do is hit play. Nowadays, a lot of people love to use Alexa and tell her, just play this kind of music, and she's really great at bringing up music that complements the song that you want to hear once you get that going. Encourage your loved ones and the people you're caring for to sing along with you. If they start singing a song, sing along with them. And provide those opportunities to sing, to make music, to connect. Um, if somebody used to play an instrument, making sure that that's still available to them. They might not play the same way that they used to, but they might still gain a lot of joy from tinkering around on it, playing just, like a little bit here and there. So making sure that those are available is really important. Dancing together. Even if somebody is in a wheelchair, we can sway side to side, encouraging people to move a bit. Going to concerts or pulling up virtual concerts or events is always something that you can do with your loved one. And, just incorporating music into everyday life. I think sometimes when people are trying to figure out what music to play for someone, there's a lot more thought that goes into it than needs to. There's a concern of, oh, what's the right music? And what do I play? Play what you've listened to with that loved one throughout your life. Play music that you enjoy and see how they react. A great example of this is when my grandmother was dying and she had dementia. And my mom, after the fact, was talking with me and she said, yeah, she was agitated and we were trying to figure out what music to play for her. We didn't know what music we should play. We didn't know what was right. And I was like, well, I wish you would have called me because I could have given you some suggestions. But what ended up being the thing to relax her was turning on a baseball game on TV. And my mom said, and it was just like at that moment, oh, yeah, that's what she used to listen to. Whenever we would go over, she would be listening to a baseball game or she'd have it on TV. So it makes sense that if that's what she's been listening to throughout her life and is a comfort to her, that is what would work at end of life as well. So, thinking about the music that somebody listens to throughout their life, but also the sounds. So maybe somebody really likes to listen to a book on tape and, incorporating that as well, or nature sounds. It doesn't just have to be music and the perfect song. There's so much more that we listen to throughout our lives to use when we're working with our loved ones with dementia. That's a little bit of an overview, and I know a lot going on there. I would love to hear if people have questions and if anybody has any comments or questions about how they can use music with their loved one. Feel free to put it in the chat or mute yourself if you just want to ask a question. That is all right. I'll let you keep thinking. And I will, in a second, turn it over to Marin to talk a bit about the study that we have been working on together. Before I do that, I just want to, say that because dementia is such a spectrum, what works for one person might not work for the other. And we're able to tailor it to the needs of the person. So if somebody is, you know, has a fresh diagnosis and mild impairment, we can work with that person. We can discuss, their feelings and what music they want to continue to listen to. Um, if they throughout a decline, and we can come in, when somebody is in those later stages of dementia and also tailor it to their needs. So tailor it to their sensory needs, tailor it to that stress relief and that relaxation aspect of it. So throughout that progression, we do our best to tailor it to that individual person. Marin, I'll let you.
Maggie, can I ask you a question real quick, Maren, before you
Yeah.
start? If somebody is interested in music therapy, what is the best way to find music therapy? Is that something they have to order from their doctor or their doctor order, or how do they get access to music therapy?
They do not. I'm going to put something in the chat. You don't necessarily need a doctor's orders if you are in a hospital setting. Like UK has music therapy. So if you were in that setting and you are wanting music therapy there, you could ask your doctor or your nurse to put in an order. So in that setting, you would need an order for music therapy. But if you're wanting to, you know, hire somebody independently through a private practice, go through that route. You can Google music therapy in Lexington, and there are a couple of different private practices that might come up. I am going to put our CBMT um, link in the chat as far as finding providers in the state of Kentucky. So they have a list of everybody in Kentucky where they are. Um, and let's see. Here we go. I might look for as Marin chats, but um yes, I would suggest that. Or, there are some private practices in the Lexington area that provide it as well. So you might look into that. There's I think 4 or 5 practices in Lexington. If you're in a different part of this state, you might, Google music therapy plus where you are in this state. I will let Marin kind of take over and get this link pulled up as well.
Thanks, Maggie. I learned some from you there also. So thank you so much. I'm Marin McGimsey. I am I think, lead social worker is my technical title on our study for music. The long term is music therapy and social work telehealth for older adult well-being. We call it Mellowswell. That is the short name for it. And what we're doing in this study is looking at whether or not interaction between a music therapist and a social worker improves outcomes for the older adults that we're working with. So some people within the study are randomly assigned to collaborative, which means that the social worker and the therapist are working together. And others are non-collaborative, which means that I'm not allowed to see their notes. They're not allowed to see my notes. It's all kept totally separate. So the way that it works is you do an eligibility screening. We make sure that you're eligible, that you have the right status for this study, which is an older adult, age 65 and older, who lives in the state of Kentucky. And then once we do all of the eligibility and the consent, the participant receives music therapy sessions and social work sessions. So first you have 4 music therapy sessions. So perhaps you're going to work with someone like Maggie, and she would do 4 sessions with you about in the manner which she's talked about here previously. And then you would get to meet with me. This is all done via telehealth. So it's all done via Zoom. I would meet with you via Zoom and do a kind of typical what someone would think of with social work. We're going to do an assessment. We call them the biopsychosocial assessment. It means we're looking at different aspects of your life, including your physical health, your mental health, your emotional health, your connections in the community, medical issues. And then we're going to discuss what your goals and priorities are within the social work visit for things that you may need some barriers removed. An example I like to give is Medicare doesn't cover eyeglasses. So maybe someone is having a hard time getting a new pair of eyeglasses due to its cost prohibitive. And so what I'm going to do is I'm going to look for resources to help that person. So that's our first visit. We're going to identify, we're going to talk about your situation, and I'm going to go and do some research. I'm going to go do some work. Then you get 4 more sessions with the music therapist. So this is, again, I'm doing this with Maggie right now with 2 participants. And so she's going to work through her part. And then I'm going to come back and I'm going to say, that last visit, these are all the items we talked about based on my notes, based on our conversation. I prepare a packet that has all of the resources and referrals that I can find that relate to those items that has been identified by the participant as things that are goals for them to achieve or some barriers they need removed. Like I said, perhaps we find there's a program that'll help pay for new eyeglasses. And so I find this program, I get the information for it, provide hopefully a link to like an application, that type of thing. Then I believe was it 4 more music therapy visits, right? Is it a total of 12? Sorry. 8, that's right, sorry. Yeah, so you have the 8 music therapy visits, but you actually get a 3rd social work visit. So after I've given that packet of information, after I've gone through everything in that visit, then about a week or 2 later, we're gonna have one final visit. And this is where we don't wanna leave you hanging. I give you all this information, you try and connect with it. Maybe it didn't quite work, or maybe you have some further questions. And so I'm gonna come back and say, okay, what can we kind of look at? If for some reason there are issues that need to be dealt with outside the scope of our study, I do have some connections with social workers, for instance, at the Lexington Senior Center if you're in Fayette County, and I'll refer you out to them as people that can work in a more consistent way um, to help continue with those issues because I am limited to the 3 social work visits within the context of the study. And so this is a pilot study right now. It's not super big, but we're hoping, I think, for things to go well so that we can expand it. And I do think it's a great opportunity for people who are 65 and older, whether there's a dementia diagnosis or not, we take both, to get that free music therapy. I mean, I think that's fantastic. You get 8 free music therapy sessions. You have the 3 social work sessions. This is no cost to you. There's a nice little incentive at the end for completing everything. And it's really just such a wonderful way to access some resources and also help further the research and how we can help people, older adults in particular, to meet their goals and to meet their needs. So if there's any questions about the study or about what we're doing there, I'd be happy to talk about that also.
Well, Marion, thank you for sharing. If you still have questions, please jump in and chime in. But I'll make sure that I get a web address or some way that if somebody's interested in the study, who would they contact?
So the study is done through the UK Center for, gosh, it's a long name. It's translational studies, is that right?
Translational science. Yes.
Translation science, yes.
Mhm.
And let me see. I think I can provide a link, but I'll also send that to you,
Yeah, if
Sarah.
you'll email it to me, I'll make sure I email everybody who's registered. So, and that I'll also email out the music therapist search that was just posted in the chat too, so people have access. I really appreciate you both sharing, Maggie sharing how powerful music can be and how as caregivers we can use music. It's helpful to kind of know that we may have to go to that early adulthood or even a little bit earlier in life when we're looking for music for our loved one, to find a way to connect, but it's never bad to try different things. And like you said, build a playlist. I like that idea, especially of orienting for seasons. We think about that at Christmas time. We don't always think about that at fall or spring or summer to like have music to help orient us to the season. So I liked that. And then also talking about things that aren't music, like a baseball game, and how that can be just as powerful. So I appreciate you sharing, and I'm excited about the research that's being done combining social work and music therapy. And I know I've talk to caregivers who are excited to know that things like this are out there and that research is being done to like scientifically show how powerful music can be. So I appreciate you guys both sharing and informing us about this. I think it's much needed information to continue to get out to people. So thank you. Any
Thank you for
last
having us.
questions?
Sarah, I would like to put out there that because our study doesn't just focus on dementia, I've had some, great sessions. Music therapy might look a little different than what I described as for music therapy with dementia clients. And so sometimes it's more lyric analysis and discussing music, putting together, like a biography, an autobiography through music, that sort of stuff. So music making is not necessarily required for it, especially over telehealth. Sometimes it can be a little tricky, but I'm always happy to do it. But you don't have to have any musical knowledge to engage in music therapy. That is my job, to make you successful in your music experiences. So it does not require previous music knowledge or experience.
That's good to know. What if you have somebody, or have you ever had somebody who they say their loved one's not musical at all? So they're like, they've never enjoyed music before, so music therapy would not be a thing for them. Have you ever had that experience and then been able to make some good connections and surprise family members?
Yeah, and sometimes people don't want to listen to music, and that is entirely okay too. I don't want to push something on somebody if they don't want to do it. And sometimes, especially like in a hospital setting or something, sometimes music therapy is the only thing we have control over. And so getting to say no to it is okay. We don't want to try to make somebody do something they don't want to do. But as far as people who, never interacted with music a lot or didn't play an instrument or something, and somebody doesn't think they're musical, that definitely doesn't mean that they won't benefit from music therapy. Maybe again, it's finding sounds that they enjoy. I have something called an ocean drum that is a great sensory tool and provides sounds that are similar to the ocean waves. And so playing something like that, or playing a drum together and providing that tactile and auditory feedback together can be energizing. So maybe we're not like playing actual songs, but we're drumming together and we're using a steady beat to entrain with each other and to connect with each other. And that can be the opening to start a conversation or to introduce more music. So even if somebody has not been a big music person throughout their life, that doesn't mean that they necessarily won't benefit.
Well, it's a very quiet group today. But I do appreciate again you guys sharing. It was a wealth of information. I think it's a lot for us to think about and great things for us to try. One last question real quick for you. When working specifically with caregivers, have you found ways that music therapy can be helpful for caregivers?
Oh, yeah. Working to come up with those plans for relaxation, so finding some music to use for relaxation, pairing it. We can pair the music with guided meditation and work through that, and then discuss what worked for you in that and what didn't. Finding those resources for your own enjoyment of the music to make it as effective for you as possible. So determining what is that music going to be, because it can be overwhelming to choose, like, where do I even start to choose these songs? So narrowing that down and talking about creating a plan for relaxation and stress reduction by using music, or talking about the music, picking a song and discussing how it is relevant to your life and how you connect to that song as well. So, absolutely.
All right. Well, we're getting close to our end of time, so we'll go ahead and wrap up if nobody has any additional questions. I will make sure that I send out information about how to connect with the research study if anybody is interested in that, as well as how to find a music therapist in your area. If you have any other resources that you want to send to me that I can send out to all who registered, I'll be happy to share those as well. If people have additional questions, they can always reach out and I can try to help make connections going forward.
Feel free to share my email. I am happy to answer any questions that anyone has.
All right. Well, again, I forgot I didn't have my camera on. Thank you all for participating, and for the two of you for sharing this important information. We greatly appreciate it. So thank you.
Thanks for
And
having us.
You.
everyone have a great rest of the afternoon.
Thank you.